सूबे ਦੀ ਚੀਫ ਮੈਡੀਕਲ ਅਧਿਕਾਰੀ ਡਾਕਟਰ ਡੀਨਾ ਹਿੰਸ਼ਾ ਨੇ ਸੂਬੇ ਅੰਦਰ ਚੱਲ ਰਹੀ ਕੋਵਿਡ-19 ਮਹਾਮਾਰੀ ਅਤੇ ਤੇਜ਼ੀ ਨਾਲ ਫੈਲ ਰਹੇ ਓਮਿਕਰੋਨ ਵੇਰੀਐਂਟ ਨੂੰ ਹੌਲੀ ਕਰਨ ਲਈ ਸੂਬੇ ਵੱਲੋਂ ਚੁੱਕੇ ਜਾ ਰਹੇ ਕਦਮਾਂ ਬਾਰੇ ਜਾਣਕਾਰੀ ਪ੍ਰਦਾਨ ਕੀਤੀ। ਉਹਨਾਂ ਦੱਸਿਆ ਕਿ ਸੂਬਾ ਆਪਣੀ ਟੈਸਟਿੰਗ ਪਹੁੰਚ ਨੂੰ ਸੋਧ ਰਿਹਾ ਹੈ ਅਤੇ ਨਾਲ ਹੀ ਉਹਨਾਂ ਅਪੀਲ ਕੀਤੀ ਕਿ ਲੋਕ PCR ਟੈਸਟ ਦੀ ਬਜਾਏ ਰੈਪਿਡ ਟੈਸਟਿੰਗ ਨੂੰ ਤਰਜੀਹ ਦੇਣ।
I also know that our surveillance teams have worked tirelessly since the pandemic began. That's why for the next week and a half, we will be modifying our reporting to give our teams a break while still keeping Albertans informed over the holidays. Next week, I will hold 2 live public updates on December 28th and 30th. I will provide an overall update to Albertans on the Omicron situation at those times, as well as general numbers for cases and tests completed. We will post our usual detailed data online on the 29th of December, including a daily breakdown of case numbers from December 24th to December 28th. We will provide another detailed daily breakdown of cases following the holiday break on January 4th and every weekday thereafter. The schedule could change and is dependent on the situation we're facing next week, but it is our balance between giving teams well-deserved time off and keeping Albertans informed. Turning to today's numbers, over the last 24 hours, we identified 1,625 new cases of COVID-19 and completed about 11,800 tests. Our positivity rate is 13.6%. There have been no deaths reported to Alberta Health in the last 24 hours. We have seen a significant uptake for third doses since we opened them up to any Albertan age 18 or older who received their second dose at least 5 months ago. As of yesterday evening, 196,391 booster doses have been booked since we expanded to age 18 and older.
ਟੋਰਾਂਟੋ ਵਿਖੇ ਇੱਕ ਵੈਕਸੀਨੇਸ਼ਨ ਕਲੀਨਿਕ ਵਿੱਚ ਟੋਰਾਂਟੋ ਦੇ ਮੇਅਰ ਜੌਨ ਟੋਰੀ ਨੇ ਪੱਤਰਕਾਰਾਂ ਨਾਲ ਗੱਲਬਾਤ ਕੀਤੀ, ਜਿੱਥੇ ਉਹਨਾਂ ਨੇ ਸੂਬੇ ਅੰਦਰ ਫੈਲ ਰਹੇ ਕਰੋਨਾ ਦੇ ਓਮਿਕਰੋਨ ਵੇਰੀਐਂਟ ਸੰਬੰਧੀ ਸੂਬੇ ਦੇ ਜਵਾਬ ਬਾਰੇ ਇੱਕ ਅਪਡੇਟ ਪ੍ਰਦਾਨ ਕੀਤੀ। ਉਹਨਾਂ ਦੱਸਿਆ ਕਿ ਇਸ ਨਵੇਂ ਸਾਲ ਦੇ ਵੀਕਐਂਡ ਦੌਰਾਨ 14,000 ਤੋਂ ਵੱਧ ਨਵੀਂ ਵੈਕਸੀਨ ਅਪਾਇੰਟਮੈਂਟਸ ਉਪਲਬਧ ਕਰਵਾਈਆਂ ਜਾਣਗੀਆਂ। ਇਸ ਦੇ ਨਾਲ ਹੀ ਮੇਅਰ ਨੇ ਮਹਾਮਾਰੀ ਦੌਰਾਨ ਕਮਜ਼ੋਰ ਵਸਨੀਕਾਂ ਦੀ ਸਹਾਇਤਾ ਲਈ $1.2 ਮਿਲੀਅਨ ਦੀ ਵਾਧੂ ਫੰਡਿੰਗ ਦਾ ਐਲਾਨ ਵੀ ਕੀਤਾ।
I'm pleased to tell you that this is a really good example. This clinic that we're in, and you can see the size of it behind me, has gone from being able to provide 5,280 doses a week to now being able to deliver 11,000 doses a week, and we're looking to push that capacity even higher. In fact, we were told when we were on a brief tour this afternoon that 2,500 doses, booster shots in the main, but total doses, 2,500 were done here yesterday, and they expect to do the same again today. And so we came here today to thank the staff because, you know, in the end, as I said to them, and speaking a moment or two ago, we can have all the meetings downtown of the people who are in positions of leadership to help us get through this pandemic and get people vaccinated, but it's the people on the ground, the Team Toronto, as we call it, of which we have a large number here, who are actually getting this job done. And Team Toronto is continuing to increase our capacity to vaccinate, and in particular with respect to booster shots across the city. And it's happening in a whole bunch of different places, including here at Woodbine Mall and the other 4 city-run vaccination clinics and mobile clinics. It's happening at more than 500 pharmacies across the city. It is happening through primary care providers, principally doctors, and it is happening in hospital clinics and through the clinics run by Ontario Health teams. And I shouldn't in any way underestimate the fact that we have a lot of other clinics that are happening beyond the ones that the city itself runs, because this has been a partnership all the way through with the hospitals and with other healthcare providers. And it's why you see us adding new appointments almost every day as we continue to ramp up, so even more people can join that number. This week alone, we've added more than 26,000 new appointments in our city-run clinics, including more than 6,000 new appointments over the Christmas holidays and more than 14,000 new appointments over the New Year's weekend. COVID-19 won't take the holidays off, doesn't take the holidays off, doesn't even know it's a holiday, and so we're not taking the holiday off either. Our team is going to be working through the holidays to make sure that we can vaccinate people, and that's why we've been able to open up those appointments, because people agreed to work during those particular times. And so I want people to know, again, this is part of the reason why we're here to pay tribute to the Team Toronto members here at Woodbine, and we will be out again doing so on Christmas Day, because there are people who have stepped up and said, they would work on that day. I'm proud to announce again today as well that we will be investing approximately $1.2 million to extend the work of TO Supports to July of 2022. TO Supports is an organization that has, or a program that has leveraged community expertise and partnerships to support Toronto residents who are most disenfranchised by the pandemic. So in other words, facing consequences from the pandemic that may not be faced by everybody.
ਬ੍ਰਿਟਿਸ਼ ਕੋਲੰਬੀਆ ਦੇ ਮੰਤਰੀ ਰਵੀ ਕਾਲੋ ਅਤੇ ਮਾਈਕ ਫੋਰਨਵਰਥ ਨੇ ਵੈਨਕੂਵਰ ਵਿੱਚ ਇੱਕ ਪ੍ਰੈਸ ਕਾਨਫਰੰਸ ਕੀਤੀ ਜਿੱਥੇ ਉਹਨਾਂ ਘੋਸ਼ਣਾ ਕੀਤੀ ਕਿ ਨਵੀਨਤਮ ਕੋਵਿਡ-19 ਪਾਬੰਦੀਆਂ ਕਾਰਨ ਸਥਾਈ ਤੌਰ ਤੇ ਬੰਦ ਕਰਨ ਲਈ ਮਜਬੂਰ ਕਾਰੋਬਾਰਾਂ ਨੂੰ $10,000 ਤੱਕ ਦੀ ਰਾਹਤ ਗ੍ਰਾਂਟਾਂ ਸੂਬਾ ਸਰਕਾਰ ਵੱਲੋਂ ਦਿੱਤੀ ਜਾਵੇਗੀ। ਇਸ ਦੇ ਨਾਲ ਹੀ ਮੰਤਰੀ ਫੋਰਨਵਰਥ ਨੇ ਇਸ ਬਾਰੇ ਇੱਕ ਅਪਡੇਟ ਵੀ ਪ੍ਰਦਾਨ ਕੀਤੀ ਕਿ ਸਰਕਾਰ ਸਰਦੀਆਂ ਦੇ ਮੌਸਮ ਲਈ ਕਿਵੇਂ ਤਿਆਰੀ ਕਰ ਰਹੀ ਹੈ।
On Tuesday, Minister Dix, Dr. Henry, and I announced new restrictions to help flatten the curve given the sharp rise that we are seeing in COVID-19 cases. The Omicron variant has proven to be much more transmissible both here and around the globe. Our healthcare workers are working overtime to keep people safe and respond to the surge in cases. But we need British Columbians to redouble our efforts to slow the spread and to avoid any further burden on our hospitals. We need to support our healthcare workers and help ensure that healthcare services continue to be there for people when they show up at hospitals needing care. Also on Tuesday, I spoke of the efforts of the Provincial Minister and COVID-19 Working Group to investigate supports for those who are affected by the new restrictions. And I want to report that due to the efforts this week of the Ministry of Jobs, Economic Recovery and Innovation, Minister Callan, who is joining me today, will run through the details of those new supports. Funding relief is coming for those businesses ordered closed. These closures are not something that anyone wants before the holidays, but the reality is we are faced with having to make these restrictions to protect each other and our hospitals. I also want to take this opportunity to reiterate a warning about the severe winter weather we are expecting through to the new year. In the coming days, periods of heavy and blowing snow, freezing rain, and very cold weather are likely in most parts of BC. In some areas, that weather has already arrived. We've been working this week to ensure both provincial road crews and First Nations and local governments are prepared for what is to come. Along with coordination calls and Office of Support, Emergency Management BC's regional offices have been distributing Environment Canada notifications to local government staff to help to prepare overall preparedness.
Today, I'm pleased to announce that the Government of British Columbia is establishing the COVID-19 Closure Relief Grant. This new grant will be available for businesses that have been ordered closed by the recent public health order. Relief grants will be between $1,000 and $10,000 in one-time funding that will be provided to eligible businesses based on their number of employees, following the similar formula that we used for the previous Circuit Breaker Relief Grant Program, which supported businesses in spring 2021. This grant can be used to help with expenses like employee wages, like paying rent, insurance, and maintenance and utilities. I wanted to share this news with you today so that businesses know that financial support is on its way and that we're committed to helping them through these very difficult times.
ਨਿਊਫਾਊਂਡਲੈਂਡ ਅਤੇ ਲੈਬਰਾਡੋਰ ਦੇ ਪ੍ਰੀਮੀਅਰ ਨੇ ਸੂਬੇ ਅੰਦਰ ਚੱਲ ਰਹੀ ਕੋਵਿਡ-19 ਮਹਾਮਾਰੀ ਨੂੰ ਧਿਆਨ ਵਿੱਚ ਰੱਖਦੇ ਹੋਏ ਸੂਬੇ ਅੰਦਰ ਸਖਤ ਪਾਬੰਦੀਆਂ ਦਾ ਐਲਾਨ ਕੀਤਾ। ਉਹਨਾਂ ਘੋਸ਼ਣਾ ਕੀਤੀ ਕਿ ਅੱਜ ਰਾਤ ਤੋਂ ਹੀ ਨਵੀਆਂ ਗਾਈਡਲਾਈਨਸ ਜਾਰੀ ਹੋਣਗੀਆਂ। ਅਪਡੇਟ ਕੀਤੀਆਂ ਪਾਬੰਦੀਆਂ ਵਿੱਚ 12 ਅਤੇ ਮੂਵੀ ਥੀਏਟਰਾਂ ਨੂੰ ਬੰਦ ਕਰਨਾ, ਰੈਸਟੋਰੈਂਟਾਂ ਦੀ ਸਮਰੱਥਾ ਨੂੰ ਘਟਾਉਣਾ ਅਤੇ ਘਰਾਂ ਦੇ ਸੰਪਰਕ ਨੂੰ ਸੀਮਿਤ ਕਰਨਾ ਸ਼ਾਮਿਲ ਹੈ।
It is with an extreme sense of déjà vu when I say that I know everyone's anxiety levels must rise when you hear the words unscheduled media briefing. But our intention is only ever to keep you informed and to keep everyone in Newfoundland and Labrador safe. In a few moments, Drs. Fitzgerald and Haggie will update you first with the news that the entire province will be moving to Alert Level 3 later this evening. And then share news on the continuing arrival and rollout of boosters and ramping up of mass vaccination clinics. Our team is working incredibly hard to get those doses out where they are needed as soon as possible when they land in the province. So please continue to be patient and be kind. Your kindness now to everyone you encounter is more important than ever before in this pandemic. Please know that none of us on this panel want to be here right before the Christmas season, and we know the public health measures are tough, and the rising threat of Omicron is disheartening for all of us, especially after all we've been through and during this special time of year. I know we are again asking people to dig a little deeper and find the energy and the fortitude to help us all face what we are up against. But I feel like we are already doing it. I see that in the overwhelming number of inquiries regarding those booster shots. Just days away from the holiday break, I know the timing couldn't be worse. And in the spirit of the season, health is one of the best things you can all wish for. So let's embrace that, and let's do our part. Please listen, remind, and reinforce those public health measures. Keep distance, mask up, wash your hands, and keep your contacts low. Stay at home if you feel sick. Get tested if you have a symptom. And please arrange to get your booster shot. I know that will require some patience, but trust us as we continue to ramp up and accelerate the delivery of those vaccines. Your actions today will certainly make incredible impact tomorrow. On behalf of all of Newfoundlanders and Labradorians, let me provide a direct message to our frontline healthcare providers. We know you've been through one heck of a year, and you're exhausted, tired, fatigued. We know that you're doing your best in these trying times, and please know that we are all here to support you and cheer you on as you look after all of us. So please keep up the hard work.